Hi, my name is Sarah Heenan, and I'm a family nurse practitioner student in the Advanced Health Assessment Lab doing a basic proficiency assessment. So first I'm going to start by, before I enter the room, I'm going to do hand hygiene before I touch the patient. I'll walk in, I'll look at the patient's appearance, make sure he's clean and well kept, dressed appropriately for his age, gender, culture, and weather. And then I'll check for the mood and affect and his orientation. So first I'll walk into the room and introduce myself. Hi Nathan, my name's Sarah and I'm going to be the nurse practitioner doing a head-to-toe assessment on you today. Does that sound okay? Perfect. Okay. So first I noticed that he is clean and well kept. Good hygiene noted, no odors noted. He's dressed appropriately for his age, gender, culture, and the weather today. So first I'm going to ask, what's your full name?
Nathan Foster.
And your date of birth?
03/01/95.
Perfect. Do you know what year it is?
2018.
Good. And do you know where you are right now?
Doctor's office.
Good. Do you know why you're here?
Head-to-toe assessment.
Good. So he is alert and oriented ×4 to person, place, time, and situation. His mood and affect seems appropriate for age and situation. So I'm going to go ahead and move on to my head-to-toe assessment, starting at the head. So first I'm going to be looking for any nits or lesions or any abnormalities. We're not recording.
I don't think, yeah, you are.
Oh, we are. Lesions, abnormalities, even hair distribution throughout the scalp, and hair's even throughout. There's no nits, no lesions, no abnormalities noted there. So then I'll move on to the face. So I'm looking at the general skin color, which is pink to tan in color, normal for ethnicity. I'm going to check for the warmth throughout, so towards the core and the trunk, and then as well as the extremities. Skin temperature is warm, skin is smooth, minimal moisture noted, skin's dry and intact. Extremities are cooler than the core, which is normal for this patient, normal for any patient. So then I'm going to start with the eyes. So first I'm going to check for the 6 cardinal extraocular movements. So first you're going to follow my finger, just with your eyes, not your head. And I'm looking for any nystagmus or any abnormal movements of the eyes, any shaking, which I do not see. Perfect. Okay, and then I'm going to check your pupils. So I'm going to shine a bright light in your eyes. You just look right at my nose. Perfect. And pupils are equal, round, and reactive to light. Pupils are 5 millimeters in size bilaterally. Pupils are equal. I'm looking at the nose, and it's midline with the face. It's symmetrical. There's no drainage noted. Looking in the ears, I see no drainage. Ears are symmetrical and equal bilaterally. I'm going to have you open up your mouth. So I'm looking, stick out your tongue for me, say ah. The uvula is midline, no deviation, no abnormal enlargement of the tonsils, no lesions or any other abnormalities to the mucosa. Oral mucosa is pink, moist, and intact. Tongue is midline. Lips are pink and moist, and smile for me. Teeth are intact. So next I'm going to check for facial movements and facial symmetry. So I'm going to have you smile. Now frown. Raise your eyebrows and puff out your cheeks. Okay, so symmetry in the face is equal bilaterally from left to right. So next I'm going to check sensation, function with a safety pin and a Q-tip. So what I'm going to do is you're going to feel either a sharp sensation or a dull sensation, and you just let me know. I'm going to have you close your eyes. We're going to do this on the face. You just let me know if it's sharp or dull.
dull, sharp, dull, sharp, 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 dull.
Perfect. And I'm going to go ahead and continue this test and do it throughout the body. We're going to do it on the upper extremities, lower extremities, and the trunk. So first we'll do upper extremities if you'll keep your eyes closed.
Sharp, sharp, dull, sharp, sharp, dull, 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 sharp, dull, sharp, dull, sharp, 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 dull, sharp, dull.
Perfect. So upper extremities sensory function is intact and equal bilaterally. Next I'm going to do the trunk. If you'll sit up straight for me.
Sharp, 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 dull, dull, sharp, 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 dull, sharp, dull, dull.
Perfect. So trunk sensory function for dull and sharp sensations are equal and symmetrical from left to right. So lastly, I'm going to do the legs with the same test. So keep your eyes closed.
Sharp, dull, sharp, dull, 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 sharp, sharp, dull, sharp, dull, 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 sharp, sharp, sharp.
Perfect. So sensory function for sharp and dull sensations is intact and equal in the lower extremities bilaterally. So next, let's see, I'm going to go with the neck. So I'll have you sit up straight, and I'm looking to see that the trachea is midline, which it is. There's no deviations noted. I'm going to have you swallow. No difficulty swallowing. Neck appears symmetrical from side to side. I'm going to check range of motion of the neck. So if you'll go left, right, up, down. He has full range of motion. Any pain with that?
Nope.
Okay, and I'm going to palpate. Any tenderness noted to the neck?
Mm-mm.
Okay, I'm also going to palpate the spine. Any pain or tenderness to the spine? Okay, so I'm going to have you sit up all the way straight, all the way. And then I'm going to have you bend completely over as far as you can. And no pain with that?
Nope.
Okay, and I'm also feeling for any masses. And the spine is midline down the back. No masses, no tenderness to the neck or spine. Full range of motion to spine and neck. So next I'm looking at, I talked about the skin is warm, smooth, it's dry, it's all intact. I'm checking for clubbing of the fingernails, which I don't know any clubbing on the fingernails of the hands bilaterally. I'm going to check cap refill, which is less than 2 seconds on the hands, and then I'll check on the toes as well. Cap refill is less than 2 seconds on the toes bilaterally. I'm also going to check skin turgor on the back of the hands. It's an instant recoil, which shows good hydration by the patient. Next, I'm going to palpate pulses. So for carotid, I'll only do one at a time. I don't want to do both at the same time. So I'm checking to make sure it's a strong pulse, which it is. Strong, grade 2+. It's a regular rhythm. And I'm only, just to save time, I'm only going to do the rate on the radial pulse. But normally you could check the pulses, all the different locations, to make sure you're getting an accurate number. So then for carotid, I'm going to check to make sure that the right side is the same and equal bilaterally and symmetrical. So it's also a grade 2+. It's strong. It's a regular rhythm. And again, I'm not going to count the rate at this time. Next, I'll do the brachial. And brachial, you can do them simultaneously. So once I feel it on both sides, I can tell that it's symmetrical. It's grade 2+. And it's a regular rhythm. And then next, I'll move down to the radial pulse. And it's a grade 2+, regular rhythm. And and it's strong and equal bilaterally. And then I'm going to count, normally I'd count for 30 seconds. I have to use the timer on here. But I'll count for 15 to save time, and then I'll multiply by 4. Okay, so I got 15, so 15 times 4 is 60, so his heart rate is about 60 with the radial pulse. And again, I could check all of the rates, but just to save time, I'm not going to. And then I'm going to move down to the popliteal pulses behind the knees. Thank you. And I feel that they are strong and equal bilaterally. They're grade 2+. And it's a regular rhythm. And then I'm going to move down to the posterior tibialis. Can't really see that. And it is a 2+ grade, strong and equal bilaterally with a regular rhythm. And then lastly, I skipped femoral. I'll do that when we're laying down, and I'm going to do the dorsalis pedis pulses, which are strong and equal bilaterally. Just want to show dorsalis pedis on both sides, grade 2+. And these are posterior tibialis back here. And they were both 2+, strong and equal bilaterally with a regular rhythm. Okay, so while I'm down here, I'm also checking for any extremity peripheral edema. There's no peripheral edema noted to the legs or the feet. And I'm also checking on the arms. I don't see or feel any peripheral edema to the arms or the hands. Okay, so next I'm going to look at the chest, and I'm inspecting first. I see that chest rise is equal bilaterally. It's deep chest rise with inhalation and expiration. I'm looking at the rate and the rhythm. So it's a regular, nice, even rhythm with deep exhalation and inspiration, and no dyspnea or difficulty breathing. Ease of breathing is normal for this patient. So I'm going to go ahead and auscultate, and I'm going to start in the right upper lobe and then compare it to the left and work my way through all the lobes anteriorly. And I'm listening for a full cycle of inspiration and exhalation. And I'm going to count the rate. Normally I would do 30 seconds, but for this I'm going to do 15 seconds to save time, and I'll multiply it by 4. So in 15 seconds, I got 4 respirations. So times 4, that's 16 for the respiratory rate per minute, which is normal for this age group. So next, I'm going to palpate the anterior chest just to feel for any masses and any tenderness. So is there any tenderness when I palpate your chest? Good. And I don't feel any masses. So now I'm going to move on to the posterior trunk. So if you'll turn just a little bit. First I'm going to check for symmetrical chest rise with my thumbs on his back. So if you'll sit up straight and take a big deep breath in. and out. Okay, and chest rise was symmetrical. Now I'm just inspecting, looking at the back. There's no abnormalities. So I'm going to go ahead and auscultate and listen to all lung fields posteriorly. And anteriorly, breath sounds were clear and equal bilaterally with no adventitious breath sounds in all lobes bilaterally. So I'm going to go ahead and listen. Again, I'm listening for a full cycle. Okay, and posterior breath sounds were clear to auscultation in all lobes bilaterally, no adventitious breath sounds heard. And then lastly, I'm going to palpate. So let me know if you feel any tenderness. No tenderness? Okay, and I don't feel any masses as well. Okay, so I'll go ahead and sit up. And the chest looks symmetrical. Configuration is normal. So now I'm going to move to the heart. I'm going to start by listening to the right of the sternum. And I'm listening for S1, S2, and any abnormal sounds that I may hear. And then I'm going to listen at the fifth intercostal space, mid-clavicular line on the left side, listening for the point of maximal impulse, which is the apical pulse. And I hear S1, S2. I don't hear any thrills or any murmurs. And again, I'm going to count the pulse. And I'll do for 15 seconds and multiply by 4. And I got 16, so 16 times 4 is 64, which before when I counted the radial pulse, I got 60, so that's a pretty accurate number between the two. Let's see, so I'll have you sit up straight, and then I'm just looking at the arms. While I'm here, I'm looking at muscle tone and any abnormalities on the arms. Muscles are strong and equal bilaterally. I'll check range of motion, and I'm checking all the joints, shoulders, elbows, wrists, and hands, all for any checking for symmetry. I'm checking for any warmth, any pain, tenderness, or swelling, any crepitus when moving the joints. So any tenderness when palpating here, perfect. And then I don't feel any crepitus or any warmth or swelling on either the elbow or the shoulder, and they're symmetrical in size and movements. No pain or tenderness there. Pain or tenderness on your wrists, no, and I don't feel any warmth or tenderness or any warmth or swelling. No crepitus when moving the joint. Full range of motion noted on your arms, perfect. Now I'm going to test strength on your arms, so go like this for me. I'm going to push down, you're going to push against me. Don't let me push down, and then same. Push up, good. Like this, and then you're going to push out. I'm going to push against you, and same going the other way. Perfect, and then I'm going to have you squeeze my hands as tight as you can. So I just tested for strength in the upper extremities bilaterally. They're strong and equal bilaterally on the upper extremities. Muscle tone is normal and equal between the two upper extremities. I'm going to do the same thing with the lower. So I'm going to test, I'm looking at the muscle tone, and it's equal and strong bilaterally. Muscles are normal between the two lower extremities. So I'm going to have you lift your hips or your knees up to the ceiling and then push them down. Okay, I'm going to have you kick your legs out. Perfect. And then pull towards yourself. Good. And then your feet, you're going to push down like you're pushing on a gas pedal. Good. And then pull up like you're pulling your toes to the sky. Okay, and then we're going to go out. Good. And then in. Perfect. Okay, so lower extremities are strong and equal bilaterally. Full range of motion in lower extremities. I am going to go back and do my sternocleidomastoid resistance on your face. So I'm going to push against your face while you push the other way. Don't let me push. Good. And then the other. Perfect. So sternocleidomastoid resistance is strong and equal bilaterally. And then I'm going to do shoulder shrug resistance. So you shrug your shoulders and lift your arms up. And don't let me push down. Perfect. So shoulder shrug resistance is strong and equal bilaterally. Okay, so I'm going to move down to the abdomen. So I'll have you lay down. And first I'm inspecting. I'm looking at the abdomen. The contour is flat stomach. Movement is symmetrical with him breathing in and out. Inspiration, exhalation. It's symmetrical from left to right. Hair is evenly distributed throughout upper trunk and lower extremities. Hair is evenly distributed. No skin abnormalities noted other than tattoos noted to left arm, left trunk, left side, right bicep, and then right leg, upper and lower legs. Next, I'm going to auscultate the bowel sounds, starting at the right lower quadrant. Okay, so bowel sounds were active in all 4 quadrants. They were not hyper or hypoactive, they were normal. Next, I'm going to lightly palpate and see if there's any tenderness going around the abdomen. Any tenderness noted?
Nope.
Next, I'm going to do deep palpation, so I'm going to go deeper and I'm going to feel for any masses. Again, any tenderness
Nope.
or any organomegaly, and I don't feel any. Lastly, I'm going to do the femoral pulses, since I did not check those. And it is strong, bilaterally 2+ grade, regular rhythm. Again, I won't check the rate right now, but I could compare that to my radial and my apical pulse. Perfect. Okay, I'm going to have you sit up for me and just make sure I went through everything from head to toe. And I believe that's everything. Thank you.